Destiny?
You had asked and we have answered. You were kind enough to ask for topics that you wanted to hear about. And so this is one of the topics that you requested, when home is no longer an option. So let me go through quickly a little bit of housekeeping. On the bottom, you will see a chat box. And so if you have any questions, please type them in there. We will leave time for questions after we speak. And at the end as well, we'll answer any questions that are in there. You can also take yourself off mute at the end as well, and if you want to ask questions directly. Okay.
I just lost my screen sharing. I'm sorry, it's me. Did they take it away? It's not on my screen anymore. I can't see your slides anymore.
Right, I'm sorry. So that was the introductory slide, but there won't be slides during the presentation.
Perfect, sorry to interrupt.
No problem. Okay, so my name is Nicole Christensen. I am the CEO of Care Answered. I'm a board certified patient advocate, as well as the author of the book From Crisis to Calm, a patient advocate's take on healthcare coordination for you, the common caregiver. And within that book, there's lots of tips on how to navigate the healthcare system for anyone that has it, for their loved ones, for themselves. And it talks a lot about transitions. And one of those transitions, as we all know, is when we think that home is no longer the best option for ourselves or our loved ones. So we're going to talk a little bit more about that. And with me, I have a special guest, Adam Flattau of Senior Care Authority. I've worked with him with our clients many times, and he's an excellent professional, great at hand-holding and making sure people get know the options that are really best suited for them. So thank you so much, Adam, for being here. So in general, long-term care and options have always been a little bit foggy for people, or to be able to truly understand it. There's a lot of confusion around it. And that was before a pandemic hit. So I'm going to start with the basics of some options of outside the care of home, and then I'll talk a little bit about what we're facing now in this pandemic, okay? So in my experience, there are so many reasons why people feel that their home is no longer the best option for them to receive the care it needs or to age in place. Some of those reasons include when somebody lives alone and the care needs that they have are so intensive that they don't believe that they can get that care at home. So they're seeking elsewhere for a place that would provide that care. Sometimes people live with their loved ones, but those loved ones can't provide the care. They're working full time, they have other care obligations, and they're not able to put in the time or have the know-how to provide the care appropriately. Then there are times when people have lived in their own home, right, for their whole lives, and they've lived in the same home, but their entire neighborhood around them has changed, and it doesn't feel like home anymore. So they want to live in a community that would better serve them, as well as get their care needs met. And then there are folks that, you know, their family's spread out. They don't want to live in the same home that they had. They want to live closer to family and get their care needs met. There's a whole host of reasons. And for every reason there's a person that goes behind that. So we can't know all of the reasons, but there are many. So let me start out with the basics, the difference kind of care opportunities or options outside of the home. So one is independent living or senior living. some people call it, or 50 and above living situations. And that is kind of how it sounds, right? It's for people that, older adults generally, and they can live on their own, but they would like to live in a community that potentially has things that they like close by. They might have different capabilities for recreation that it's presumed that that population would like, that kind of thing. So that's the first one. Then there's assisted living. Now, assisted living, Adam's going to talk largely about, so I'm not going to go too much in depth, but on the surface, it is what it sounds, right? It's living with assistance. So you may need some assistance, and there's different licenses as well to provide different levels of care, but there is some assistance involved. Now, I'm going to take a quick derailment here and talk about adult care facilities, because that's not a term that's common in most people's vernacular, those that don't work in this kind of industry. So I'm going to define that, because there's also been some confusion about that in regard to this pandemic. So adult care facilities have 5 or more residents. And it's licensed and supervised by the State Department of Health. And they provide temporary and long-term non-medical residential services to room, board, housekeeping, personal care, and supervision. So that's a pretty broad definition. And assisted living falls under that, but there are many others that fall under that. So from there, I want to talk about nursing homes or skilled nursing facilities. That's what I find most people think all of these things kind of fall into. And currently in the media, they've kind of lumped them all together as well, which is not fair or true, and it kind of confuses people even more, I believe. So let me just describe what a nursing home or a skilled nursing facility is. It's more like, it generally has a more hospital setting rather than an assisted living, or certainly independent living has more of a home setting. And it has a more hospital setting to the naked eye because it provides generally more skilled nursing care. And so they'll have doctors on staff, they'll have nurses on staff, they'll have the capability to feed people through feeding tubes, the capability of providing IV medications, having physical therapy and speech therapy and occupational therapy on site, and a whole host of different doctors and specialists contracted to the facility. So it makes it a little different. So with that, I'm going to talk about CMS. And I'm making these or describing these things for a reason so that it can be less confusing at the end. So bear with me. So CMS is the Centers for Medicare and Medicaid Services. Okay, and it's a federal agency within the US Department of Health and Human Services that administers the Medicare program and works in partnership with the state to administer the Medicaid program. And it also administers other state programs. So skilled nursing homes and rehabilitation facilities that are generally, there's a rehab within a skilled nursing facility oftentimes. They are paid for by Medicare and Medicaid, okay? So for shorter term, it's Medicare. For longer term, it's Medicaid. People can pay privately for it, but that's their funding source. And I mention it because that's also where they get their guidance from. And there are different things that they have to keep in mind that may be different from your general adult care facilities. Okay, the last one that I want to talk about is continuing care retirement communities. So these are oftentimes communities that can go from independent living, and if you think of it as graduating in care needs, so independent living all the way to nursing home and everything in between. So that's what those programs can actually provide. So they're a little bit of everything that I mentioned, or they can be set up to have everything that I mentioned. And then there's obviously things like group homes and other kinds of homes and communities for people, for adults, potentially not just older adults. So, and to be honest, there are things that are going to be thought of, and communities and ways to age within a community. Those things are being thought of all the time. So what I'm talking about today, there may be new and interesting and wonderful things that fit the bill in the near future. So again, as I said, these delineations or these descriptions of different kinds of services and communities and care has often been confused, but in particular during this period of this pandemic, it's become more confusing. So I want to talk about, it's a sticky topic, but one that I think people are requesting to know more about, if you don't already, is the number of deaths that have occurred in skilled nursing facilities and adult care facilities. Again, a lot of times we hear it all lumped in together. And the truth is that there was a guidance put out stating that the adult care facilities and nursing homes needed to take all COVID positive or presumed COVID positive patients. And this likely led to many more deaths than should have happened. I say this because you have a population that is vulnerable to the disease already, mixed with people that are also vulnerable to the disease, but also have the disease. And obviously we all know that it's very contagious. At this time, you know, where could they have gone other than these facilities, being readmitted to the facilities or to these facilities? I don't know. We all know that the number of testing and the PPE equipment wasn't certainly available as it should have been. So I don't know what would have happened differently, but that was the course of action starting in March. But then this week, things changed, and the guidance is that they are, those skilled nursing facilities as well as adult care facilities are not to take COVID positive patients. And the onus of determining whether the patient is COVID positive is on the hospital. So that's what's enacted now, just this week. In addition to that, these adult care facilities and nursing homes have to test their staff every 2 weeks and report if anybody is positive. And with that, they were told that if they don't do that, do not follow this guidance and regulation, that they will lose their license. So the question on the advocacy, policy advocacy side is, okay, are all of these tests going to be available for all of these sites? Again, I don't know that we know that for sure is going to be available to say yes or no, but I know that people are working to make sure that it is. So we are at a time, it was a dark and horrible time. We lost our loved ones, we lost our friends. And I'm hoping that with the shutdown and the tests and the PPE, that this won't be a regular occurrence, that it will slow it down and people will get the care that they need in in a space that is good. So that's what we're seeing looking forward. And I guess time will tell a little bit, but my hope is that this new guidance will be effective. So does anybody have any questions in regard to that? Let me look in my chat.
Hey, Nicole, I don't have a question, but I just wanted to make note. It's actually the employees have to be tested twice a week, not every 2 weeks.
Oh,
Kathy, I was going to say the same thing.
Thank you. Thank you. I misspoke. Thank you.
Yeah, it's twice a week.
Thank you.
You're welcome.
Any other questions or comments?
Okay. I have a question.
Sure.
Hi, Nicole. So where are people who need subacute level services supposed to go if they can't go to, who are COVID positive, if they can't go into rehab facilities or long-term care facilities?
That's an excellent question. And I don't know. They said that they set up, what I've heard is, and people can speak up on this as well, like the Jacob Javits Center and other sites are potentially taking those folks, as well as there have been some work, I know, with having separate wings, if you will, for COVID positive. I don't know what that's looking like now. Does anybody have any, because these guidance are put out, but the logistics are not necessarily as clear as they should be.
Yeah, Nicole, a lot of the subacute, as well as including assisted living, quite frankly, but through the entire spectrum, have been doing a very good job of cohorting positive and presumed positive away or in separate areas from those that are not positive. I don't want to say negative, but not positive. So, and that's in all different types of facilities. And then according to the guidance that also came out, I don't know which ones they are, but there are supposedly some facilities that are exclusively for COVID. I don't know which ones they are, but if somebody was ever in need of finding that out, I'm sure they could reach out to me, maybe Nicole, and through a little digging, we could figure it out.
Yeah. Again, this is new, and sometimes the logistics take a second to catch up with the guidance, but that is exactly what I heard, Adam, as well. Any other questions? Great, thank you so much. So with that being said, let me introduce my friend and colleague, Adam Flattau of Senior Care Authority. We have worked together with different clients, and he's just, again, wonderful at hand-holding and making sure the options are clear for assisted living options. So he's going to talk more about assisted living then, now, and maybe he has a crystal ball into the future as well. So thanks so much, Adam, for being here.
No, thank you, Nicole, for having me. I appreciate it. And thanks, everybody, of course, for attending. For those that know me, you know I'm a positive, upbeat person, probably more so than most, but like all of us, I'm tired of this. I'm tired of not being able to see my friends. I'm tired of not being able to see my loved ones and family. I'm tired of eating way too much crap. And no offense, I'm tired of Zoom calls and not being able to, you know, get out in person. But what I'm also really, just coming from the industry, what I'm really tired of is hearing all the negativity associated with senior living facilities and how they're all the same and they're all problematic. It's just not true. We're going to discuss it a little bit, but it's just not true. The one thing that I'm definitely not tired of, or certainly not tired of hearing, are quite frankly how nurses and doctors and hospital staff, all the way, you know, into the cafeteria, janitorial staff, whatever they are heroes. But I do want to also make sure that, we include the caregivers and all the staff at assisted living communities that are putting their lives on the line every day to take care of our seniors, and they're probably a little bit more unsung of the hero, so to speak, but not tired of hearing it and not tired of saying that. Before I get started, I wanted to share two quick stories with you that I think illustrates a lot of what we'll be focusing on today. Timing is everything, and just this morning I got a call from the daughter of the very first person that I ever placed in assisted living. I was expecting some bad news, from 2 years ago, all of a sudden getting a call. Now I stay in touch with the families that I place all along, but I wasn't, in the midst of everything that's going on, wasn't expecting something good. It was the exact opposite. Julie called me to say thank you, let me know how wonderful her mom is doing. When we initially spoke 2 years ago, Julie thought for sure that her mom would need a skilled nursing facility because she was almost bedridden. She had advanced dementia and was on hospice. I brought up memory care at an assisted living community, and the family, quite frankly, didn't really know too much about it. We discussed how the warm, nurturing, social environment could be good for her mom. Not to mention, quite frankly, half the price of a skilled nursing facility as well. So you fast forward 2 years, mom is doing great. She's off hospice. She's alert, she's happy. Now she still has dementia, but she's doing wonderfully, and to everybody's surprise. And Julie just wanted to say thank you. So that made me feel great, and I couldn't wait to just share that with everybody today. But I do have another story also that kind of speaks a little bit more to the appreciation that families really have to the caregivers. Just about the last person that I placed in an assisted living community back in February of this year, her daughter Stephanie was very concerned because this was right around COVID really starting to sprout up. And we put her mom into the community, and and then in early April, she called me to let me know that her mom was COVID positive. That wasn't really the purpose of the call. Her mom was doing okay. She was COVID positive, and she's still doing okay right now. She called because she was concerned about the staff. She wanted to know of a good restaurant near that community, because it wasn't really near her, that she could call to get food delivered to give to all of the caregivers that are taking care of her mom. That touched me tremendously, and it just goes to show how important assisted living is in the scheme of things. And as an elder care consultant, I speak with families every day about the different care solutions, whether it's skilled nursing, home care, assisted living, independent living, memory care, everything that Nicole just spoke about. And more times than not, the families and the seniors themselves don't know what each solution really has to offer. Seniors often think of assisted living as a nursing home, just like the media is kind of grouping everything together. But that's what they grew up with. That's what they knew. So they remember what it was when they were growing up, and they think it's all the same. It's all hospital-like settings. Assisted living didn't even start here in the United States until the early 80s. And I guess understanding the impetus of assisted living is important to understanding how it has grown, evolved, where it was yesterday compared to today, and hopefully the utmost importance, where it will be tomorrow. So we'll talk a little bit about that, but as I said, assisted living is relatively new, and it is a far cry from yesterday's nursing homes. And having those conversations with families about the real differences between skilled nursing facilities and assisted living communities today is usually the first stumbling block that I encounter when talking with families, and it's always a stumbling block of the assisted living communities themselves. But you know, I think it was in the 70s, Dr. Karen Brown Wilson understood that there was a need for senior living with a more private social setting and still be able to take care of those seniors. And she examined all things negative about skilled nursing facilities and came up with the idea of assisted living, which was more private rooms, 24-hour care for emergencies, security, and communal settings for social activities. In 1981, in Oregon, the first assisted living community was started. Here on Long Island, believe it or not, we didn't have the first assisted living community until the 90s. And in the mid-2000s, we had on Long Island about 60 communities. Today, we have about 100 communities, assisted living, independent living, memory care communities on Long Island, serving seniors of all different socioeconomic types, personalities, and care needs. They all provide social interaction. It is a social model, not a hospital or medical model, but they all provide a good social environment with varying levels of needs of assistance. Therefore, assisted living. It's not skilled, it's assistance. So those seniors can live their lives to the fullest each and every day. You know, I was going to go into some statistics now about the importance of socialization and how isolation can really impede development and personality and physical health as well. But I don't think in today's environment we need to go into statistics. We're all kind of feeling it, and we know ourselves how important being around other people are, and it may even be more important, quite frankly, for seniors. So just keep in mind that social aspect of assisted living is the foundation of assisted living. So what is assisted living? It's a social model with varying levels of care that afford our seniors a home to live in, to thrive in, to be safe in, and quite frankly, have fun. And unlike skilled nursing facilities, most assisted living communities are private pay, not Medicare or Medicaid. And they offer more of a, I guess, more of a home-like private living spaces with areas of socialization within them. Now, while assisted living is considered a long-term living solution, the rental agreements are 30-day leases. And they include two components, rent and care. And most of the communities also require something called a community fee, which is a one-time fee payable upon entry. But what the rent includes at just about every single assisted living community are their private or semi-private apartments, meals, almost always 3 meals a day, communal space, housekeeping, laundry, movie theaters, on-site hair salons, access to the visiting doctors, security, supervision, transportation, organized social activities. I mean, that's all part of the rent. The care component is a little bit different, and it's determined as a result of an individual assessment performed by the community. And each community arrives at these care levels in different ways, but ultimately they're the same based upon the level of assistance the resident requires and the amount of time that the staff and the caregivers are going to need to meet that assistance. Part of this component is also something called medication management, which when needed allows the resident to be administered medications as per the prescriptions, and the community is also responsible for refilling those prescriptions. So it takes that burden off of the family and off of that senior. And as one would think, the more care that one needs based upon this assessment, the higher the monthly cost is going to be. But many people are very, very surprised as to the extent of care that assisted living can provide and don't realize that it is very, very often a great alternative to skilled nursing facilities. So as demand grew for, as demand grew for assisted living, so did the types and the services and the licensing associated with these communities evolved as well. Most communities, I said, are private pay, but there are a handful of communities on Long Island, about 8, and it's maybe getting a little bit more, that do accept Medicaid. For the most part, these communities are known as Assisted Living Program, or ALPS. And those ALPS are basically exclusively Medicaid, usually have long waiting lists and a lot less care ability because their licensure doesn't go up as high as some others. But we're starting to see some of the other predominantly private pay communities accepting Medicaid to some level. Then there are the independent living communities, which Nicole spoke about a little bit, and they're basically an assisted living community that doesn't offer care or assistance with ADLs. They have all the amenities, but they don't offer that. There are some communities here on Long Island that are considered all-inclusive. And what that really means is that each resident is basically paying the same amount regardless of the level of care that is needed by that resident. So it's a lot easier to gauge what the future is going to hold there. But in the same regard, if you don't need a lot of care, you're paying just as much as somebody that's getting a lot of care at that community. A lot of the memory care neighborhoods within assisted living communities are starting to go that route as well, just an all-inclusive rate structure. And speaking of, as dementia became more prominent, many communities started to offer their own secure memory neighborhoods, memory care neighborhoods within the walls of the assisted living community. And as we've gotten to all of these different types of communities and the care levels of our seniors were increasing, there became different licensing structures. There's 100 communities on Long Island. The majority of them are adult home and enriched housing. And it is the DOH, the Department of Health, that governs the licensing and issues the licensing for all of these communities. And typically these adult home and enriched home and enriched housing communities are going to be a little bit less expensive, still have all of the amenities, but they're going to only be able to offer a certain amount of care to their residents. So it's important when making that choice for which type of community you want to go into to take the future into consideration as well. Because if you go into one of these homes with a lesser licensure stature, they're going to take wonderful care of you, believe me. And many people can spend their entire lives at those level of communities. But if you or your loved one all of a sudden needs a little bit more care, that communities, they're not going to say you have to leave, but they may say you have to hire a private aide, or if that's just not affordable, then they may just say, I'm sorry, you are no longer within our licensing capabilities, then you'd have to leave. The advanced license is called the enhanced license. There are about 40 different communities on Long Island that have that advanced license right now. They typically have more nurses and more caregivers on staff, and it allows those communities to provide substantially more assistance to the residents, such as assistance with ambulation, two-person transfer, Hoyer lifts, injections of medications such as insulin, colostomy care, olostomy care, and just a whole slew of other items that are falling just short of what would be mandated for a skilled nursing facility. So, you know, again, picking that right community with the right licensure and the right resident makeup is just as important as the location of the community and the cost of community, because ideally you really only want to make this move once. So that's assisted living, okay, and its components. I'm going to go into a little bit the impact of COVID and how communities are behaving now and what the future might hold. Before I do that, I'll ask if anybody has any questions you want right now, or you want to save them for the end. That's fine. Can Adam address admission for someone who's in a wheelchair but can transfer independently? Yeah, absolutely, Pam. A wheelchair, if two different things. If you are able to self-propel the wheelchair, right? Just about any community should accept you. It would technically go against Nicole, what's the handicapped regulation? I forget what it is.
ADA.
ADA, right. I'm sorry. It would go against ADA. If you're able to, you know, self-propel in your wheelchair, that shouldn't have any impact. However, a lot of communities are going to suggest going to an enhanced community if you're in a wheelchair, because if you go to, if you're in an enhanced community, regardless of whether you can self-propel or need assistance in transferring, you should be, if that's one of the only ailments that you're facing, should be no problem with admission there, okay?
Adam?
Yes.
Nicole put up earlier and sent the link to Medicare's nursing home compare site.
Yes.
Is there any equivalent for assisted living facilities, or is that called 1-800-ADAM?
It's 1-800-ADAM to get the real deal. All right, Louis, but there is, and I have on a handout, there are some links that are on there. The DOH actually has a website or a link that you can go to. It's not so much going to give you the ratings, because the ratings are only for participating communities on a different site. So I didn't want to share that because it's not all inclusive of everything. But on this site, the DOH site, it's going to give you information on the specific community, the type of licensure it is, as well as the ability to look up any violations or enforcement actions against that community.
And that's going to be available for everybody with this recording. It'll be sent, and attached will be the takeaways. So that'll be available. There's another question here, Adam, to discuss the costs of assisted living on Long Island.
Okay. Well,
you could speak about that for like 3 days. So
yeah, well, I could honestly, I could speak about any of these items that we covered for 3 days, but the cost, the average cost is about $6,000 a month. That being said, to say what the cost is for any specific individual, you really can't do, because that second component that I spoke about, the care component, is very unique to each individual. And it's hard to say what one person is going to generate in care fees next to the other. So I can place people, and I have placed people in beautiful communities for $3,900 a month. I've placed people in communities that needed a whole heck of a lot of care for $12,000 a month. So when I say the average cost is about $6,000, that's pretty much it. And you know, and again, each community is so incredibly different and has so many different things to offer. It's tough to put a general price on something. I hope that helps a little bit, but if there's any specific community anybody's thinking about, I'd be more than happy to talk with them about it.
Yeah, he can go into the level of detail for specific questions. Absolutely.
Is that good for now?
I think so.
Okay, so we're living in the world of COVID-19. As you would expect, demand is down, all right? Nationally, communities that offer both assisted living and independent living saw a 51% decrease in demand April 2019, April 2020. That's nationally. I expect it to be even a more dramatic decline here on Long Island because we're in the heart of what everybody is feeling. There was a 27% decrease in initial tours and a 22% decrease in move-ins, again, April to April. These are substantial. You know, on a positive note, however, the amount of move-outs, and this is probably somewhat related, the amount of move-outs decreased by 15%. Okay, so more people are staying where they are. And that might be, again, because of COVID and the reasons why I think demand is down and people are kind of staying put is fear. It's, you know, people don't want to have the risk of catching COVID. They read and hear a lot and they don't know what the right decisions are. There's also, as you know, stay-at-home policies are in place. So that frees up a lot of adult children to care for their senior loved ones now. And why put somebody into an assisted living community if their family can take care of them sufficiently right now? That's probably going to change in the near time, but you know, that's one of the reasons also. And probably the single largest reason why people aren't making the move, quite frankly, is that they can't go visit them. Once somebody goes into a community right now, visitors are not allowed, and we're going to get into that in a little bit, but that is from most of the people that I speak with, that's the single biggest reason as to why they're not making a move right now. And then within the community, the quarantines that are happening to keep everybody safe does diminish the social aspect of the communities. Not entirely, but it does diminish it. And that decision to move or now or to wait is very, very individualized, and it truly, truly is going to depend upon each family's unique situation. There are also communities right now that are not accepting new residents on Long Island, more than a handful, quite a few actually. But you know, in the same regard, there are many communities that are accepting new residents. They do, however, change their protocol as to what they're doing. They have modified admissions and policies that have gone into place. All of the in-person tours that is always the highlight of my day when I get to walk around with a family and a senior and show them the tours. Those are no longer right now. They'll be back, but right now everything is being done virtually through FaceTime and websites, and it's actually going surprisingly well. Then what I mentioned before about that in-person assessment to determine the care level of a person coming into a community of a potential resident, for the most part, those are not being done in person anymore. Those are FaceTime assessments, and they're still going through everything to determine the cognitive ability and the physical ability of that resident, but they're being done on FaceTime. Some communities are requiring COVID tests prior to admission. Some communities have kind of a COVID protocol, so to speak, meaning that you or your family member cannot have had a fever for the past 72 hours. You had to be asymptomatic for the past 72 hours. They'll ask questions about travel restrictions over the previous 72 hours. And then once you do go into a community, almost all of them are having the new residents go into a 14-day quarantine in their room upon admission, with the exception of memory care neighborhoods. Memory care is a whole different ballgame right now because you can't quarantine those people in the memory care neighborhoods. They're just not going to stay in their rooms. So going into a memory care neighborhood right now is very, very different. And I'm not sure as to exactly how that would happen, to be perfectly honest with you. But the quarantine, when you're going into the community, isn't really all that different from anybody else that's living in that community, because right now, what's really happening inside of the communities are, for the most part, residents are quarantined. Meals are being served in their rooms. There's, as we said, there's no visitors, not even family can come into the communities. The doctor's visits and the physical therapy that's happening are being done in the residents' rooms. Some of the communities that have the ability are cohorting COVID positive residents into certain areas or certain floors. PPE, thankfully, is in abundance right now at the communities, and it's being used everywhere. There's temperature checks being done daily on all the residents and the staff. And as Nicole mentioned earlier, as of this week, all staff needs to be tested twice a week. But it's not all doom and gloom. Social directors and program directors are being very innovative. They've set up hallway chair exercises so the residents can sit in the doorways of their hall, of their rooms in the hall with a lot of other residents and do their chair exercises. They're doing that with some meals sometimes. They have hallway bingo happening. FaceTime appointments are being made, and the staff is being so fantastic as far as going from resident to resident to make sure that they're being able to FaceTime with their family and stay in touch. I've seen crafts being done in residents' rooms. Communities are starting to think about ways to bring back communal dining. For those that have big dining rooms, they'll be able to stagger the seatings, so there will be able to be some level of communal dining going on, just not to the extent that it was yesterday. Closed circuit TV is running throughout the communities to keep everybody informed and entertained. And from a staff standpoint, a lot of these communities, not all, but a lot of the communities are seeing nice bonuses and increased compensation for their staff, and a lot of the communities are hiring new workers. And as we progress through this pandemic, we've been seeing substantially fewer new cases and new deaths in assisted living communities as a direct result of what the communities are doing and as a result of the recent legislation and guidance that Nicole was just talking about. It is absolutely having an impact.
Thank you, Adam.
Yeah.
Thank you. It's always wonderful to hear all this wonderful things I see all the time from my colleagues and on social media, all the wonderful things that they're doing within these communities to make their residents feel great and their families feel like they've made a great choice and are involved in their care. And like all of us, honestly, the things are changing by the moment, and people are really rising up to meet this new time. I wanted to just touch on two things. One is that, yes, I did put on the Medicare.gov, the nursing home compare. I put that in the chat for anybody to copy, paste, or write down. That is available to everyone so that they can compare potential nursing homes. Again, this is skilled nursing facilities against another skilled nursing facility to see what they have going on. It is a tool. It is not the end all be all to make a decision, but it certainly gives you some information. When I'm working with my clients and regarding finding an appropriate skilled nursing facility or rehab, one of the things I look at is the the staff to resident, the ratio there, because, and again, that can change. That's one day in time. So today, tomorrow, they can be completely different numbers. So that's why it's only a tool, but it's something to definitely to look at. All of the things are important to look at, but I want to bring that out as well. And in the takeaway, as Adam had discussed, again, with the information about the assisted living facilities, it's a tool. It's not going to tell you everything. And so Adam is a really good person to call and get the inside scoop, and as well as to make sure it fits the need, because it's not a one size fits all in any of this. So does anybody else have any more questions? Okay. Oh, let me just say there's something that Berthany wrote. The hospitals cannot discharge patients unless they test negative for COVID-19. That is absolutely correct. So
Right.
the onus is not on the assisted living or the skilled nursing home, skilled nursing facility. It is, the onus is on the hospitals. They cannot discharge if they are coming up positive, and they have to test their patients before discharge. Okay. Well, thank you, everyone. I really appreciate you being here and asking great questions and sharing your expertise. I think it's really beneficial for all of us, and I love seeing your faces. So I'll say goodbye for now. We're going to take a week or so off from the Care Answered webinars. I will be doing a radio show, I'll let you know, with Project Independence on May 29th about kind of navigating through this new normal, or the ever-changing new normal, really. And some other things are coming up in the works, so I'll share that with you online. And I wish you well, and for all those mothers, belated Happy Mother's Day, and for all of you, just enjoy the beauty of the season and stay safe and be well. Take care,
Thank
everybody.
you.
Thank
Bye.
you, Adam.
Thank you,
Appreciate it.
Nicole.
Thank you, everyone.
Thank you.
Take care, guys.
Bye-bye.